a lot of patients feel very embarrassed or don't really feel comfortable going in to see a doctor face to face and having a conversation about their sexual health, something that's very private, something that's very personal to them. And actually recently we did a survey that kind of dives into this topic, and I'd love to hear what your thoughts are on this. But the stats are of the survey that 50% of people so that they don't feel connected to their partner, right? That they don't really have that level of intimacy with them. And that 66% said that their libido was lower than they wanted. What do you feel like might be causing like this drop in libido and intimacy?
My heart goes out to these patients because I have worked in the sexual health space for almost the entire time that I have been in the telehealth industry. I've had ventures or companies and things that I've been involved with that touch on sexual health. And the more I learn, the more it blows my mind, because our sexual organs are body parts that we have chosen to place some sort of moral judgment on. Good, bad, clean, dirty, okay to talk about, not okay to talk about. Like if you start to lose your vision, you're not going to be embarrassed, probably, to go talk to an eye doctor about the fact that you can't see. But if you lose the functionality of your penis, are you going to be embarrassed talking about it? Are you going to be embarrassed going and seeking help? I think nowadays we've come a long way, and many people would answer no, but a lot of people would still answer yes. And I do think we have a long ways to go to think about these are body parts that are organs that they exist, and they were designed for these functions. And when a part of our body has a dysfunction and it's not working, then we owe it to ourselves. We owe it to our partners as well in this instance. And as physicians in the healthcare community, we owe it to our patients to provide them with a place where they feel like they can come and get their needs met.
Yeah. You know, I think that you really hit it on the nail, that there's a lot of baggage when it comes to the reproductive system, to the sexual systems within the body. You know, it's one of those things. I think that part of it is that you know, you bring up vision. Vision is so crucial for day-to-day life, and if all of a sudden you become blind, your ability to go out and do tasks is critically impaired, right? I think that maybe part of it is that like sexual health isn't necessarily seen as like a absolutely crucial or absolutely essential part of life, and so people say, oh, I guess I'll have to do without. But you know, I think that we're moving in medicine and in wellness that is like, it's not just about like being able to survive, it's about being able to thrive in an environment and to be able to feel the way you want to be able to feel and have the type of relationships that you want to have with your partner, which, you know, seeing these things of like libido and intimacy and all these things dropping, you know, from what we've seen, and our demographic kind of veers towards the age group of 40s and 50s. I think that a lot of people, when they hit that, they're not necessarily expecting that their libido is going to drop.